Hook, are you feeling overwhelmed by tricky NCLEX questions? Hi, I'm here with Level Up RN. In this video, we're going to talk about the NCLEX format. You may have heard that it's a computer adaptive test, or CAT. That is kind of like a fancy way of saying that the NCLEX is a test that adapts to your knowledge. That means that if you happen to be really smart, then the questions will get harder as you go through the test. And if you're not as smart, then the questions will get easier. You may also hear that the NCLEX is a CAT that is actually just like a big multiple choice test. Well, not exactly. There are 4 different kinds of questions that you might see on the NCLEX, and only one of them is a straightforward multiple choice question. Let's take a look at those. Read the question carefully. Tip: don't read every word carefully to catch keywords like best, initial, or most important. Read every word carefully to catch keywords like best, initial, or most important. Example: a question asking for the initial action is different from the most appropriate action. The first one is called a multiple choice question, or MCQ. This is the question stem followed by 4 options, only one of which is the best answer. These are the type of questions that you probably already know how to answer. Use the process of elimination. Eliminate obviously wrong answers first. Example: if 2 answers are similar, one is likely wrong. Next is a SATA, or select all that apply question. This is where you get a question stem followed by 5 options, and you have to select the 3 that are correct. If you've taken any other nursing school exams, then you're probably familiar with this style of question. The next type of question that you might see is called a prioritization question. With this type of question, you'll see a question stem followed by 4 options, and you have to drag and drop them in order of priority from highest to lowest. So, for example, if I were ordering my patient's care, I might put the highest priority first and then 4th, 3rd, 2nd. That would be the correct order. Always prioritize airway, breathing, circulation first. Use Maslow's hierarchy of needs to decide between physical versus psychosocial needs. Example: a patient with difficulty breathing is a higher priority than one feeling anxious. The last type of question that you might see on the NCLEX is called a next-gen case study. This is a brand new style of question that was just recently added to the NCLEX, and it's kind of a beast. It's a computer adaptive question, which means that it can adjust based on your initial answer. You'll see a patient scenario followed by several parts. All of these are designed to assess your clinical judgment, your decision-making, and your ability to apply the nursing process. Don't overthink it. Your first instinct is usually correct. Avoid adding information to the scenario that isn't there. So there you have it, 4 different question styles that you might see on the NCLEX. To learn more about how to answer each of these question styles, make sure that you check out our NCLEX question bank at level.up.com NCLEX question bank. Example: if the question asks about infection control, every answer must be correct nursing practice. Manage your time wisely. Don't get stuck on one question. Move on if unsure. NCLEX is a CAT exam, so skipping won't help. Choose your best answer and keep going. Pay attention to safety and delegation questions. RN versus LPN versus UAP. Know which tasks can be delegated. Example: LPNS can do dressing changes but can't assess or evaluate. Practice. The best way to improve is by doing NCLEX style questions daily. Review rationales even for correct answers. If this helped, don't forget to like, subscribe, and drop a comment with your biggest NCLEX struggle. I'm here to help.